This is a 61-year-old woman who presented seeking some sort of treatment for rejuvenation of her face. She certainly didn't want to change who she was. She wasn't really looking for a dramatic change. She just showed us a photo of how she used to be when she was in her 40s, and she was hoping that she would get kind of close to that age. She definitely needed lifting of some sort. And we performed an endoscopic brow lift, face and neck lifts. That's a total face lift. In addition, her neck was kind of heavy, so we removed some of the fat there, and we really wanted to delineate and define that jawline, which I always think is so important. One of the main things that we really did with her was we elevated her eyebrow, but we didn't really change the eyebrow shape. With her, she definitely did not want an arch. And then we performed an upper blepharoplasty to just try to make the eyes more even, more pleasant looking. Now, if we kind of focus on her, there are several things. Number one, for eyes, there's nothing more important than symmetry. This is her left eye, and this is her right eye. Her right eye is not too bad, but it's really her left that requires a little bit more of detail. Because as you can tell, her left eye is a little bit smaller than her right. And it's not just about the fold, but it is about what we call vertical aperture. How much of the eyes really show up on a non-expressive, normal type of eye opening. And she does have some degree of what we call ptosis, which is that weakness of the muscle that occurs. For a lot of Asians, it's actually inherent, but it also occurs as we get older. And so one of the things that we did is some ptosis correction. If we take a look at and focus just on the eyes, you can tell that the left eye now looks more brighter. But that brightness doesn't come from just making the double eyelid more symmetrical or more bigger, but it's actually doing the ptosis repair so that her eyes open up, and it gives that shyness to the eyes. The next thing we did was we removed some of the bags under her eyes. And one of the things that we do, certainly as for aging lower eyelid, is not only do we just remove the fat, but we actually do what's known as transposition, which means we move the fat from the full area, where the bags are, where the fat protrudes out, and then we utilize that fat to move it down below to fill in the hollowness in what we call the tear trough area. As I stated before, for the upper part of the face, one of the main things that we want to accomplish is we want to make sure that that area is as smooth as possible, because that's a sign of youth. And so fat transposition, I think, is one of the more important things that we do when we perform lower eyelid surgery. As far as the face and neck lift is concerned, the goal here is to try to eliminate this marionette line. And with her, even with her smiling, that there really is not much of a marionette line. The other thing that we did was we tried to define the jawline better. And as you can clearly see here, that the jawline definition is certainly much more sharper and smoother. What I see is a mistake for a lot of facelift is that a lot of times we only address the central region of the neck, where we call the double chin. But I think it's so important that we actually address the fat of the entire neckline, because that's how we make sure that the jawline definition becomes more accentuated. The other feature with her is that her chin certainly doesn't look lacking, but as we can see from the side profile, that the chin prominence is lacking, and therefore giving more of an anterior projection really does harmonize the face much better. And the result is a patient who doesn't look overdone. She only looks just younger, right? And the sign of youth really is about smoothness, balance, and certain distinctive features, such as clean jawline and just smoothness of the cheek region.